Good afternoon, everyone. My name is John Arnold. Today, I will be presenting my article presentation on the research study, A Visual Analytics Solution for Analyzing and Mining Infectious Disease Data. This study explores how visual analytics can enhance our understanding of infectious disease trends, with a particular focus on COVID-19 data in Canada. I will cover the study's findings in depth, highlight its merits, discuss some of its shortcomings, and emphasize the role of information visualization in epidemiological research. Visual analytics is a powerful tool that integrates multiple technologies and methodologies to transform and understand complex data sets. In the context of infectious disease research, it helps researchers analyze large data sets to detect patterns, predict outbreaks, and guide policy decisions. Visual analytics helps uncover hidden patterns and trends, such as waves of infections or correlations with socioeconomic factors. The ability to visualize complex epidemiological data enhances decision making, which makes public health responses more effective. It enhances decision making and advances public health interests as policymakers and institutions work to combat infectious disease outbreaks. The COVID-19 pandemic has demonstrated the urgent need for sophisticated data analysis techniques to track and mitigate outbreaks. Governments and health organizations worldwide have relied heavily on data visualization tools to monitor the spread of the virus and evaluate policy measures such as social distancing and vaccination campaigns. Many industries also see major benefits from visual analytics. In this study, the researchers performed several analyses of Canadian health data related to COVID-19. The researchers' aim was to identify relationships between infection rates, hospitalizations, and socioeconomic characteristics. Through data mining and visualization, they highlight how regional differences in population density and socioeconomic conditions impact disease spread. By using real-world data in the Canadian health system, the study provides valuable insights into the dynamics of infectious disease transmission and public health interventions. Visual analytics crucially helps identify and understand knowledge that is actually implicit in the data. A key component of the data or of the study is the use of health region analysis rather than provincial level aggregation. By examining data at a finer scale, the researchers were able to identify localized outbreaks and determine factors contributing to differences in infection rates. Health regions offer a more detailed look at how socioeconomic factors, public health measures, and population density interact to influence the spread of infectious diseases. The study also focuses on peer group analysis, which categorizes health regions based on shared socioeconomic characteristics. The researchers grouped these regions using statistical clustering methods, enabling them to compare infection trends among regions with similar demographic and economic profiles. For example, rural health regions with a high percentage of indigenous populations tended to experience higher infection rates, whereas urban regions with better healthcare infrastructure often had lower case fatality rates. This approach helps policymakers understand which regions may require additional resources or make targeted public health interventions. On the other hand, by applying a time series analysis, the study captures patterns in case surges, hospitalizations, and deaths over time. The researchers identified significant correlations between infection rates and public health measures, such as lockdowns and vaccination rollouts. Through correlation heat maps and statistical trend analysis, they were able to pinpoint lag times between infection peaks and hospitalization surges, helping healthcare institutions prepare for capacity strains. Overall, the study highlights the value of visual analytics in tracking disease progression, identifying high-risk communities, and informing data-driven public health decisions. By combining multiple data sources and visualization techniques, the researchers were able to provide a holistic view of how COVID-19 impacted different parts of Canada. One of the key aspects of this study is its ability to visualize national and regional trends in COVID-19 cases. The researchers used time series graphs to illustrate daily and cumulative cases across Canada. These visualizations helped identify multiple waves of infection, showing how cases surged and declined over time. For example, the Omicron variant caused a significant spike in early 2022, which is evident in the time series analysis. These graphs allow health officials to identify key turning points in the pandemic and adjust public health measures accordingly. By examining infection trends over time, the policymakers can actually make or determine the effectiveness of lockdowns, mask mandates, and vaccination efforts in case of the next pandemic. A major assumption is that epidemiology in urban areas, due to higher population density, will experience higher infection rates. However, the study challenges this assumption. Using choropleth maps and scatter plots, the researchers demonstrate that some rural regions and areas had disproportionately higher infection rates. Factors such as healthcare accessibility, travel patterns, and regional public health policies definitely played a role in these variations. The study highlights the importance of considering multiple variables when analyzing infection rates rather than relying solely on the population density. In some cases, rural communities with limited healthcare access experienced higher case fatality rates despite having lower overall infection numbers. This emphasizes the need for targeted public health interventions that account for regional disparities. And it was very evident from the graphs, these exact points that they made. Instead of analyzing the data at the provincial level, the researchers focused on health regions, which provided a more localized perspective. Health region level analysis revealed that certain areas had higher infection rates despite lower overall population density. This level of granularity helps policymakers allocate resources more effectively and tailor interventions to specific communities. By breaking down data at the health region level, the study enables a more precise understanding of infection dynamics. Different health regions within the same province may have vastly different COVID-19 outcomes due to factors such as economic conditions, healthcare infrastructure, healthcare accessibility, and social behaviors. To better understand the disparities in infection rates, the study grouped health regions based on shared socioeconomic characteristics. Using clustering techniques, researchers found that regions with higher indigenous populations and rural settings had significantly higher infection rates. This highlights the importance of considering socioeconomics when designing public health policies. The study's findings indicate that income level, employment status, and education levels all play significant roles in determining infection rates and health outcomes. For more detail on that, look at the grouping of Group F and G. Public health policies that fail to consider these socioeconomic differences may lead to ineffective or inequitable health interventions. The researchers used additional visualizations, such as peer group clustering, to compare health regions with similar socioeconomic characteristics. These findings show that the infection rates vary significantly among different peer groups. High-density urban areas sometimes exhibited lower infection rates due to better healthcare infrastructure and stricter public health requirements and measures, whereas some rural areas with limited medical resources saw higher fatality rates. The visualizations help distinguish correlations between socioeconomic factors and disease outcomes, reinforcing the necessity of targeted public health strategies. As for the merits of the article, the study does have several strengths. First, it provides a multi-level visualization, analyzing data at national, provincial, and health region levels to offer a comprehensive view of the disease spread. This hierarchical approach ensures that the findings are relevant at multiple scales, from national health agencies to local health departments. Second, it integrates statistical analysis, employing correlation analysis and time series trends to reinforce the findings with quantitative evidence. By combining visual representation with statistical methodology, the study enhances the credibility and reliability of its conclusions. Third, it applies real-world data using actual COVID-19 data from Canada to demonstrate the practical utility of visual analytics in a public health setting. The study's real-world applicability makes it a valuable resource for policymakers, epidemiologists, and healthcare professionals seeking to improve pandemic response strategies. Despite its strengths, the study does have some limitations. It does not explicitly address key visualization principles such as accessibility or Tufts principles. Effective data visualization requires careful consideration of design choices to ensure that visual representations are clear and interpretable. Additionally, the study relies heavily on static visuals, while it uses multiple visualization techniques, interactive dashboards, and real-time visual analytics could have further enhanced insights. Furthermore, the study does not assess how different stakeholders, such as epidemiologists, policymakers, the general public, interact with a visual and analytics solution. The usability of the study would have provided valuable feedback on its effectiveness and highlighted potential areas for improvement. Visual analytics is an invaluable tool for infectious disease research and many other industries. It offers a powerful way to analyze and interpret vast amounts of data. Future research should explore ways to make visual analytics more user-friendly, adaptable to different areas and different diseases, and for public health challenges. Thank you for your time. I welcome any questions you might have or any discussions on the topic. Thank you.
Well, thank you. I think it was a little bit, I don't know the year, but it looks like 2020, 2019. So it's an interesting result, and in the sense that most of the rest of the world, the highly populated area, saw a lot more infectious rate. The rate of infection was higher because the virus was transmitting more freely than the rural areas. It kind of turned around when we got vaccines, but it's kind of unclear here how it kind of worked. But like I said, it's almost the opposite of the rest of the world. It would have been interesting for them to display that. And like you said, that may be a shortcoming of this. Yes, we only look at Canada, but especially when you get a finding that is kind of not intuitive, but counter to the data that was gathered in other countries. So anyway, thank you for the presentation.